today I'm going to take you through a Pilates workout that's designed to avoid flexion or that rounding posture in your back. This is important for you if you're a patient who's been experiencing some low back pain or some upper back pain, but is responding really well to extension or that stretching backwards motion in your back. So this workout video is designed for you so you can still get the benefit from Pilates. So today we're going to focus on some stretching, some strength, and as well as some balance. So I'm just going to have you start sitting in a cross-legged position, and for some of you this might already be a stretch, but that's okay. So just get those knees down as far as you can go without having any kind of pain. So we're going to just start with some deep breaths. So as you breathe in, you want to take your arms up overhead, and you're going to exhale and let those arms come back down. Now this is a great way to get yourself in a nice, good posture. Remember, good posture, you just want to think of a deep breath and bringing your head up towards the sky. That's the easiest way to get into a good posture. Now I also, as you're going throughout the workout today, and especially right now at the beginning, I want you to forget about everything that you were doing before you sat down to do this workout. Forget about everything you have to do afterwards and just focus on this workout. Focus on how your body is moving, how your body is feeling. Pilates is great because it helps not only your body but also your mind and that mind-muscle connection. So just focus on the workout here today. Forget about everything else. Good. Let's do a couple more deep breaths. One more. All right, since you're a patient who is responding very well to extension, let's go ahead and do some press-ups just to get the spine warmed up today. So you're going to lay on your belly and then just press on up, extend that spine. Good, and come back down. We're going to do a few of these today just to get the spine moving. Good. And if you want to get a little deeper, on this next one I'll show you how. You want to inhale as you go up. Once you get all the way up, you're going to exhale. You should see how my low back just fell a little closer to the ground there. You're getting a little bit deeper when you add that exhale. Inhale as you go up. Exhale once you get to the top. We'll do just a couple more of these. Make sure the spine is moving really well. You're releasing any tension that may be in your back right now. Great. Now from here I'm going to have you roll over onto your back. All right, so here you're going to be laying on your back, knees bent up, and we're just going to start with some proper core activation. Now, with core activation, you don't want anything bulging out. You're not squeezing as hard as you can. I like to start training this with some deep breaths. So what you're going to do is you're going to breathe in, and as you breathe in, you want to make your belly nice and big, and then you're going to exhale. We don't want our chest to elevate when we're breathing. We want our belly to fill. That lets us know that we're getting a nice deep breath. So breathe in, fill the belly, and as you breathe out, you're pulling your belly button in towards your spine to activate all those deep abdominal muscles. Those muscles, making those strong and teaching them to activate appropriately is going to give your spine some really good support as you're continuing to heal from your back injury. So breathe in, make the belly big, breathe out, pull the belly button in. Good. Now we're not doing a large pelvic tilt like you may see in some Pilates videos, okay? That would produce some rounding in the spine and we want to avoid that. So breathing in, breathing out, just activating those muscles. So keep going and I'm going to explain how you can feel to make sure those muscles are activating. So if you find your hip bones in front of your body right here, you want to go in about an inch. And as you exhale and activate those muscles, you should just feel those muscles right there tensing and kind of pulling in. No bulging should be taking place. It's just like if you're putting on a tight pair of pants and you're trying to get a button, you just kind of suck the belly in. That's what we're going for right here. We'll do just a couple more here. Get those muscles activated. Good. Good. Now we're going to go up into a bridge. Now, again, we're not going to do a big pelvic tilt. We're not going to focus on rolling up one vertebrae at a time because that would produce some flexion in the spine. But we are going to start with good core activation. So breathe in, breathe out, activate the core. Come up into the bridge and squeeze your glutes. So those are your butt muscles. So squeeze those butt muscles nice and tight. Good. Always start out with that core activation. And then you're going to squeeze your glutes at the top. Good. Keep going here. It's great to activate the core and the hip muscles at the same time. So you want to make sure that you're working both of those muscles at the same time so they can both turn on for you throughout the day and support your back. Do just a couple more here. Excellent. Good work. Now I'm going to have you roll onto your side. So from here, we're going to start to activate the sides of the core muscles and also the sides of the hips, which are really, really important to stabilize your spine. So bring your head all the way down to the floor with your arms supporting your head, and then you're going to pull your belly button in, okay? That good core activation that we just learned. And then you also want to think about pulling your side abdominals up. So there should be a room for a little mouse to get between your side and the floor here, okay? So your knees are bent and stacked on each other. You're going to take your top leg, and then you're just going to kind of kick it up and back at an angle. You should feel kind of the side of your hip, that side glute or your side butt muscle firing as you do this kick. Now, you don't want to wobble back and forth as you do this, so make sure that you keep your core nice and tight as you go throughout this kicking motion. So we're working front of the core, we're working side of the core, and we're also working front and back of the hips. Good. Keep going. You should feel that glute muscle already fatiguing. If you're activating it properly, it doesn't take much to get some fatigue. Just a few more. Good. All right, so bring your knees back down and stack them on each other, and you're going to prop up on your forearm. Good. From here, you want to take your knees back so that they're in line with your trunk here, so you don't have much of a bend in your hips. From here, you're going to lift yourself up, okay? Now again, you should be squeezing your glutes, pulling your belly button in, and also kind of lifting with your side abs. Now, you can just hold here because this is quite a bit of work, or we're going to add a clamshell. So keep your ankles together, and you're going to lift your top knee up. Good. Good, all right, keep activating. If you need to take a break, that's okay. Pull those muscles in. Couple more here. Good, all right, let's move on to the other side. So, arm supports your head, but you're all the way down to the floor. Bend those knees, top leg goes back, and you're gonna kick up and back. Again, pull the belly button in, pull the side abs in so that you have enough room for a little mouse to run back in there. And as you're kicking the leg up and back, you want to think about kicking up and back towards that corner that is right between the ceiling and the wall. So you're not going straight up, you're not going straight back. You're kind of going up and back at an angle, kicking towards that little corner. Good. Keep breathing. Make sure you're not holding your breath. Good. One more. Excellent. Good. Now prop up onto your forearm. Again, we're going to bring those knees back so that they're in line with our trunk here, and then you're going to lift yourself up. Good. Pull the belly button in. Squeeze the glutes. Lift the side abs. And if you feel ready, add that clamshell. Now, one of the great things about Pilates is that it teaches you that kind of mind-muscle connection. It teaches you to be aware of how your muscles are activating, how your body is feeling. And that's important throughout the day. How do I feel when I do a certain workout? How does my stomach feel when I eat a certain food? It helps you to be aware of how your body is reacting to different things so that you can take care of it appropriately. Good, just a couple more here. My core is firing up, I'm sure yours is too. All right, let's just come to a seated position and take a couple more deep breaths. Good job. We're doing well here. All right, so you're gonna come into standing now. So now working into our balance moves. If you need to grab a chair to help you, that's fine. That will be really helpful for you if you're struggling with the balance a little bit. So what you're gonna do is you're gonna start standing on one leg, okay? You can tap this toe down now for some balance before we get started here. The leg you're standing on, you want just a little bit of a bend in that knee. So we're gonna go into a single leg deadlift. Again, you have your chair here if you need it. So head goes down, heel comes up, and as you come up, you're pulling your belly and you're squeezing your glute on the leg that you're standing on to pull you into that upright position. Good. If you don't need the chair, you don't have to use it. It'll work the balance a little bit more though. And also, you don't have to go all the way down. You can do a half motion here. If you really want to challenge, go ahead and bring that knee up as you come up. So you're bringing that knee up, pulling the core in. You can see I'm wobbling a little bit, that's okay. You can also just tap in between. Don't hit your knee on the chair like I did. Just a couple more here, and then we'll move on to the other leg. Good, all right, swap sides. Again, so I'm standing on my left leg, knee is slightly bent, and I'm gonna bend down. Good, straight line from your head to your heel. You should feel a little bit of a pull in the back of your leg, that hamstring muscle. It's okay, we're working it. That hamstring glute is working to control us as we lower down, to give us power as we come up. Good, just a couple more here. Good, now we're gonna move on to a squat, but this is a squat with a little extra, so you may still need your chair. Now remember with a squat, you don't wanna squat with your knees going past your toes like this. That'll put pressure on your knees that you don't want, and you're not working the hips in the way that you want. So you wanna sit your bottom back like you're sitting in a chair, okay? So we're gonna just start with the squat here. Again, you don't have to go all the way down. If it's a half motion here, a half squat, that's okay. You're still gonna get benefit from it. But you're gonna come onto your toes at the top, okay? So this is working the balance a little bit, so if you need that chair, that's okay. That's why you have it there. Also, if you're feeling ready, add the arms. So this is what I like to call a triple extension, because we're really working all those extension muscles. We're getting you into a nice upright posture. And when you're coming up onto those toes, you push your hips forward a little bit more, squeeze the glutes a little bit more, engage the core. With the squat, you're also getting your heart rate up, which I'm sure you can tell. Couple more here, you're doing great, almost done. All right, let's finish where we started, come back down into that seated position, and we'll do a couple nice deep breaths here. All right, nice job today, guys. Thanks for joining me for this Pilates workout. Keep coming back to this workout if you're a patient who needs to avoid flexion but really wants some flexibility, strength,